WS Hospital is one of the leading hospitals in the market. The hospital management believes that streamlining cross-hospital processes is the next great frontier for reducing costs, enhancing quality, and speeding hospital operations. Inpatient departments were facing different types of challenges related to safety, privacy, staffing, and therapeutic support. Hospital's board of directors responded to those challenges by forming a committee, with members drawn from inpatient departments heads, medical records, IT and quality departments. The board set 4 key objectives for this committee. First, restructure inpatient processes to efficiently provide and manage inpatient care according to patient perspective model. Second, implement a software solution that allows streamlining inpatient processes, such as inpatient scheduling, insurance approvals, admission, inpatient medical records, medical and surgical care, medical reporting, discharge, etc. Third, reduce inpatient prescribing errors by 15% and drug administration errors by 20%, and at the same time, reduce inpatient operational costs by 20% and inpatient assisting labors by 10%. Fourth, the committee task had to be achieved within 3 months, within a limited budget, and without affecting normal hospital operations. The committee restructured inpatient processes to address the following key activities. 1. Manage inpatient scheduling. 2. Admit inpatients, covering both direct and pre-scheduled admissions. 3. Admit emergency inpatients. 4. Manage medical care. 5. Manage surgical care. 6. Manage intensive and critical care. 7. Manage pediatric and PICU care. 8. Provide diagnostic support, such as laboratory and radiology. 9. Provide therapeutic support, such as drugs and RX respiratory. 10. Manage patient medical information. 11. Provide and manage standards for care. 12. Discharge patients, including follow-up and home medications. To achieve hospital board's objectives, the inpatient committee contracted Webisoft's independent software provider to supply and implement their inpatient solutions, which are parts of Webisoft Hospital Management Solution, WebiHIS. Implementing Webisoft Inpatient Scheduling Solution enables physicians, patients, and admission staff to coordinate admission time and inpatient resource allocations. Using Webisoft Medical Records Solution enables admission staff to automatically schedule a medical record request to make it available at the medical record sending area before the patient admission time. Once patient arrived at the hospital reception, the admission manager is now able to print admission sheet and automatically issue a medical record movement request to the selected nurse station. Once patient arrived at the nurse station, the nurse does not have to wait for the arrival of paper medical record. She retrieves patient available data and starts directly entering the patient admission and medical data. When the paper medical record arrives at the station, the nurse consolidates computer-entered data with the paper medical record and applies physician admission instructions. Physicians are now free from most of the paperwork, and they are able to use available patient room computer screens to select symptoms, diagnosis, medications, and other orders. And at the same time, they can add minimal information on the paper medical record. Using Webisoft nurse screens, physicians can request lab investigations and review the lab results and investigations reports. Physicians can also order medications from inpatient pharmacy, indicating dose instructions and precautions. Upon receiving physicians' requests, Webisoft Pharmacy Solution checks for drug-to-patient allergy relations and drug-to-drug interactions, and automatically generates appropriate alerts. On the other hand, physicians can request diet and kitchen departments to apply certain nutrition requirements and restrictions for each patient, and they can set nutrition rules according to time, drugs, and therapeutic protocols. Using Webisoft Operating Theater's solution enables issuing operation requests, scheduling operations, applying pre-operative protocols, managing patient movement from ward to operating theater, selecting surgeon, assistant, anesthesia doctors, nursing team, and operations category, managing and dispensing consumables, following up patients in recovery room, requesting patient movement to ICU, and many others. Implementing Webisoft Nurse Station Solution enables nurses and physicians to enter patient medical parameters, record and monitor medical records movements, request investigations, medications, and consultations, process discharge activities, including follow-up scheduling, home medication instructions, request financial clearance, etc. Using Webisoft Inpatient Accounting Solution enables accounting staff to accept down payments, review patient services, issue summarized and detailed invoices, convert provided services to a package deal, process discharge financial clearance, print final invoices, etc. When ward nurse receives financial discharge clearance, she implements patient discharge protocol with the help of security and patient relations personnel. After patient discharge, the ward nurse sends patient medical record back to the receiving area of the medical records department, and the medical record staff returns it back to the correct cabinet. After implementing Webisoft Inpatient Solutions, almost all insurance policies were validated at the time of inpatient service delivery. Moreover, the inpatient prescribing errors was decreased by 20%, and the drug administration errors was decreased by 30%. Meanwhile, the inpatient operational costs was decreased by 25%, and the inpatient assisting labors was decreased by 10%.